Hello, welcome. I'm Dr. Angie Martinez. I prepared this information for educational series as part of initial patient's experience as they are preparing to come and see me. So if you're receiving this, please take some time to look over it before we visit for the first time. It'll actually ground you in a lot of new information and new insights as we take on a different direction for your health goals. If you're viewing this for an educational purposes and are not a patient of mine, please understand this is information that is not intended to diagnose and treat any specific medical condition that you may be experiencing. So please consult with your medical professional team before making any changes in your health concerning this information from this video. If you're interested and aligned with this value system and you're interested in root cause medicine, feel free to set up a discovery call with me so we can review if this is if this really aligns with your goals and if it's a fit for you. So first of all, when you come to see me, prepare to see different and prepare for different all around. One thing that I ask my patients in the beginning is, what if you looked at your story through a different set of lenses, that being a functional medicine lens? When you have a different set of lenses, it's easier now to look at your past history with a different narrative. And if you have a different sense of your history or a different lens, you can start having a different perspective and maybe have even a different meaning as to why you've been suffering for so long. In that different view, you're actually able to look and find maybe different ways of dealing with your issues and maybe different answers to your issues. And this all comes from a background of different knowledge. We're actually in functional medicine incorporating a more inclusive approach with science, taking in conventional as well as functional and alternative ways of thinking about health, which is something that's really important. For most people, I think most people are actually looking for different, and I think that you've been looking for different. And if you agree, Dr. Einstein basically has said doing the same thing over and over and expecting a different result is just crazy. And if you're in line with that, you're in the right place, because I was used to doing things the same way over and over in my conventional experience, and didn't get very far with patient care. So I think that's an ineffective way of taking care of patients, and have incorporated this new knowledge. So what is this different approach? I've prepared this educational series is in a form of a story, and the story is about good fences. And so Robert Frost said, good fences make for good neighbors, and good fences make for good health as well. In our bodies, we have barriers and boundaries, which are the fence between the outside world and the inside world. And disruption of these barriers and boundaries is correlated with the road to poor health. And if I had chapters to this story, the main concepts of this journey would include issues with inflammation, poor detoxification, and poor energy. These are foundational issues that are the consequence of disrupted barriers and boundaries and poor fences. So how does that story begin? Boundaries and barriers are essentially, as I mentioned, places where the outside world meets the inside world. And so this picture depicts parts of our body that are part of our barriers. The barriers are biochemical in terms of being some form of chemical that helps protect us, like our tears and the saliva. It can actually be chemical and physical in nature, the mucosa lining that's lining our gut, or the acid in our stomach protecting us from bacteria that tries to get in with our foods. All of these are physical natures of our barriers and boundaries. There are psychological boundaries that we have as well. If we have things that compromise our psychological boundaries, such as trust boundaries or safety boundaries, those too contribute to issues within our physical health. Those are just as important as these biochemical and chemical boundaries that I'll be talking about today. So barriers and boundaries are really important. We can appreciate that actually help protect and defend us from viruses and toxins and all those things in the outside world. But the other important aspect of a barrier and a boundary is that it's a filter, and it's set up to help us communicate with the outside world. We actually get information from food as well as toxins that tell our bodies about the outside world. These are the barriers that actually process a lot of sensory information as well. So if we smell gas in a room, we need to get that information processed to tell us to get out of the room for safety. So these barriers have additive work in that they help filter and communicate with our body. Interestingly, Mother Nature, as important as these barriers are, really only gave us one single layer of cells to help with this protection and communication, which is quite interesting, since one single layer of cells really makes us very vulnerable to the outside world. Knowing that, she actually has supported us with a pretty robust immune system that sits right next to that layer of our barriers in that layer of cells. For example, the immune cells residing in our gut lining make up 70 to 80% of the total amount of immune cells, because that's such a large portion of vulnerability. Every time we eat, we are exposed to bacteria and toxins that could potentially cross the barrier of our gut lining and get within our body and cause problems. In addition, our immune cells, in addition to the protection that our immune cells provide for us, they're also important in cellular communication. It's the immune cells that are talking to our nervous system and talking to the internal parts of our body. So the immune system does a number of things, of which to protect as well as to communicate. When it comes to functional medicine, we realize that structure equals function. And so there is an anatomy to good health, and it's really important for us to maintain a certain structure and a certain anatomy to help maintain our health. And I'll go through that. What health by design includes is, in at least with these barriers, are layers of architecture that have definitive mechanisms that contribute to health. For example, these architectural layers within our barriers help defend and repair, which is obvious, but they also help us detoxify and eliminate, especially through our skin. They're involved also with this complex mechanism of helping us recharge the energy to heal. In this health by design, the example to the right shows you a picture of your gut lining. And from the top to the bottom, this design was set up strategically to help maximize health. And so the top layer is a mucosal layer that houses a microbiome. The microbiome essentially is the bacteria that helps contribute to our health. And so essentially the top layer of our gut lining is snot and bugs. But that gut lining is really, really important for multiple things. Right under that layer is the barrier cell lining. And so there you can see the gut lining, which are those square cells that are sitting side by side. Just under that's the purple immune system depicted by the purple and blue round immunoglobulins. The immune system basically takes information from the outside world and decides if it needs to defend and repair, or it can communicate to the body and start the process of repair, or start the process of protection. Not depicted on this picture is the last layer, which is the neurologic system. The vagus nerve actually is part of that sensory program that sits under our sensory barriers and processes information and sends that to our brain. And so a lot of this information, at least in the gut lining, is processed and sent through the brain through our neurologic systems. So this design is repeated in all our barriers, and this shows pictures of that. The top picture, it's a little complex, but it shows the skin. And the difference in the skin is that we don't necessarily have a mucosal snot layer that I've described in the gut lining. That would just be weird if we were walking around with snot throughout the outer skin. But there is a top layer of skin of protection, and it happens to be dead skin. So that dead skin provides the same mechanism as the mucosa layer in our gut lining. It houses bacteria to help process information. But that design is repeated throughout our barriers, whether it's our nasal passage, our oral passage, our lungs, our stomach, our bladder. And that picture off to the bottom shows our lung. It's the same design, mucosa layer with single cell layer of lung lining and the immune system sitting there robustly trying to protect us from any toxins that might be coming in the air that we breathe. So the right design contributes to right function or healthier function. And so those same layers are listed. That mucosa layer is really important because it filters anything that's coming through. It actually is set up like a laboratory where there's lots of chemistry going on in that mucus layer. Within the bacteria and the mucus layer, there's also chemicals that help protect. And then that's the beginning of the communication and the filter between the outside world. The gut lining is also part of the right design in that there's tight junctions that keeps it closely sealed so that we can continue to protect the lower layers. The immune layer is right under the gut layer, and that, as I mentioned, will help us defend and repair. And the vagus nerve is also there where it helps communicate all this information to our brain. So the right design will give us the right function. When we have the right design, I'll go through an example. We're able to communicate using, for example, information from food. And the example they show there is fiber. So when we have fiber in our diet, that fiber is processed in that mucosa layer. The bacteria, along with the chemicals in there, will process that fiber into a new chemical called butyrate. And that butyrate chemical will pass through, and that butyrate will talk to our immune system. And in that setting, the fiber is telling the immune system that everything is at peace and everything is going well. When we're at peace with our immune system, now the immune system has the attention to focus in on repair and to focus in on making sure it's protecting us. That butyrate also can get passed up to the vagus nerve and go to the brain and also communicate with our brain. And so you can imagine if any virus or any toxin is trying to come through, it would have a lot to get through to make it within our body. So typically our innate immune system will support us with that first attack against the virus just by slowing it down with the mucus layer and then having chemistry or having these chemicals that are antiviral, and then the immune system sitting ready and revved up, energized and prepared to defend us and protect us. But when this design is disrupted, that's what leads to dysfunction and disease. So if we have something that contributes to loss of this mucosa layer or the loss of the microbiome, then we lose that top layer protection. If we don't have that top layer protection, you can see to the right, that shows that we've lost that mucosa layer. When you lose that protection, the gut lining gets what we call leaky, impermeable. Things can sort of slip through because we're not protecting that from the top layer. And if things start slipping through, whether that be bacteria or food parts, the immune system becomes very reactive because that's not normal. It shouldn't be passing through that way. And so it gets pretty inflamed and aggravated. That inflammation can get transmitted up through that vagus nerve up to your brain, and now your brain is getting these under attack SOS signals that are coming from a disruption of your barriers. How do we get these barriers disrupted? That's what we'll go through in your visit, trying to figure out what are the things in your life that's disrupting the barriers in your life. Common disruptions to that mucosa layer are things like ibuprofen, antacids, antibiotics, toxins in our foods, and probably one of the more potent toxins is stress. So that inflammation that gets revved up in the gut can stay locally in the gut, and you can start having problems like heartburn, IBS, colitis, cramping, constipation, diarrhea, and those are all signs of disruption in your gut barriers and local symptoms. But those, as you can imagine, don't stay localized very long. everything becomes more systemic. And part of the systemic translocation is this inflammation ends up in our liver. Anything coming through our gut lining will go through the liver first. And so all this bacteria that's slipping through, all these inflammatory markers that our immune system is spitting out, and even parts of undigested food gets processed, or actually doesn't get processed, it actually gets translocated into the liver. And so here you have the poor humble liver trying to deal with all this inflammatory mess. And the goal for the liver is can it get it detoxified, or at least get it processed so it can send it back out. And we're trying to get toxins and inflammation out of our body. We try and get it out through our stools, our urine, or even our skin. But the liver really needs to be, takes a big responsibility for detoxification. And so with all this overwhelming work from the gut, now the liver can't keep up with its job and now is doing poorly with detoxification. And if you can't really detoxify, toxins and inflammation become more systemic. You can't really get it out of our body, so we build up toxicity within our body. And then the liver itself just can't really function. And so it can't do all its other functions, which the liver's really involved with hormone balance. The liver's involved with sugar balances. The liver's involved with cholesterol balances. So once we get to this stage, we start contributing to a lot of metabolic problems and a lot of hormonal problems. And the last straw of all this inflammatory mess, it begins with disrupted barriers, is an increase in oxidative stress. What's oxidative stress? So reactive oxidative stress is inflammation that just progresses to very destructive phase. So inflammation in a cell causes tissues to lose electrons. So our healthy cells really want a balance of electrons. And the problem is inflammation will steal some of these electrons from cells. And that cell that is deficient of an electron is what's called a reactive oxidative reactant. And that particular cell is not happy missing an electron, so it starts looking around for other electrons. And so the amount of these free radicals and oxidative stress levels correlates to chronic disease and aging. And so as we get more and more diagnoses of complications in our health, it correlates with the amount of oxidative stress that our cells are experiencing. And so while these cells now start looking deeper and our problems start getting deeper, they look to go steal electrical charges. And the perfect place to go get electricity is from mitochondria. Mitochondria, which is a wonderful word, if you're playing Scrabble, I guess, is a specific organelle in our tissues or in our cells. It's actually an old part of our cell that contributes to the energy that runs our body. Because it is a powerhouse, that's where a lot of electricity is made. Guess where a free radical needs to go find an electron? It goes straight to our mitochondria to steal some electrons. And so this oxidative stress and free radicals are a problem because they steal our energy and our electrical frequency that we need for today, our health for today. It steals the energy and our power sources and storages that we need for tomorrow. And it steals from the energy of our health potential that we need for the future. It steals from our ability to make more energy. So we really, really get into trouble when we get to this level. So let's just talk about what mitochondria are and how they work when they are working in a healthy cell. So as I mentioned, the mitochondria is our electrical powerhouse. It's our battery source of energy. And the way we make energy in every cell is, to simplify it, because this is far from a simple process, but to simplify the process, we essentially take chemical energy in the form of food. We mix that with water, and we mix that with good oxygen levels, and we put it in this generator called the mitochondria. And this mitochondria has a lot of electrical charge. A healthy mitochondria has a lot of electrical charge. And that electrical charge can process this chemical energy into electrical energy. And this is the ATP that we need to run our body. It's essentially the battery, like the battery in our cell phones. And so we do need a lot of this electrical charge to make ATP. But if you have a lot of reactive oxidative stress stealing electrical charge, then you don't have enough potential to make energy. And so these oxidative thieves steal this battery. And what happens is we decrease the amount of mitochondria we have per cell. And then we also decrease the function or the voltage of the mitochondria. And so healthy mitochondria have actually an electrical voltage, and the example that has been given is that the good healthy mitochondria may have a 90 millivolt electrical charge, and we can run so many functions because if we have lots of mitochondria and they're all charged up to the 90 millivolt charge, we can build muscles, we can learn, we can do all these important processes in our body that need the battery to function. But when these oxidative thieves come through, they steal this voltage, and now this mitochondria might be just running on 20 millivolts, and now the body is getting a message of low battery, the same message we're getting when our batteries in our cell phones are low. And so then we get significantly decreased energy production, running on low batteries, and then we start getting into trouble. So low energy and dysfunctional mitochondria are related to structure. So you can see on that top picture how the structure of the mitochondria that's young and healthy maybe has a voltage of 90 millivolts and, churning out lots of energy. But what happens when the setting of reactive oxidative stress is you end up with this unhealthy mitochondria with low voltage. Maybe it's only functioning at 10 to 15 millivolts. And because you have very low voltage, you can't repair and heal. You can't defend yourself from viruses. You can't turn off inflammation. You can't detoxify and eliminate. You can't support these important cellular communications with hormones and or the chemical neurotransmitters in our brain. We can't protect our DNA from things like cancer or dementia or degeneration. And then more importantly, we can't continue to grow, learn, and adapt to our environment. And what does that lead to? Symptomatically, low battery is the symptoms of fatigue. Everybody coming to see me usually has some level of fatigue. Usually there's a physical layer of that with just physical drain, but maybe it's more cognitive fatigue and you just can't function and focus. A lot of times it's contributing to lots of pain, neuropathy, arthritis, muscle cramps, brain issues like emotional depression, anxiety, cognitive issues with attention, hormone issues, gut issues, toxicity issues. You can't lose weight, you can't gain weight, or you've just recently been diagnosed with metabolic problems like a heart disease, diabetes, sleep apnea, cancer, or dementia. These are all signs of low battery. So the future of medicine actually will be the medicine of frequencies. It'll be the medicine of mitochondria. We know now that healing and health require an electrical charge and energy. And quantum physics, which is actually a newer component of medicine, talks about this energy in the form of a form called scalar energy. Quantum physics describes the scalar energy as this biofield of energy that's around our cells and our bodies, and obviously it involves mitochondria. And as I mentioned, because a healthy cell and a healthy mitochondria really needs electricity, we need to maintain a certain threshold of that electricity at 90 millivolts or more. But when we get into trouble with our diseases or our symptoms, chronic symptoms we're experiencing, and or our cells are aging at a faster rate, we start losing this voltage, or at least it's the loss of the voltage that contributes to these diseases and aging. An example is that certain cancer cells have very low cellular voltage at 15 to 20 millivolts. And then in line with this quantum physics theories, there's a theory that says that healing actually takes energy, but it actually takes twice the amount of the normal voltage of energy. So if somebody has, like yourself, may have these complications for a long period of time and you may have drained your battery and have low voltage, in order for us to get you out of trouble, we're going to have to build up the energy potential not to a healthy threshold, but above that healthy threshold, so we can actually start healing and repairing. So what are we going to do when you show up, and what to expect? As I mentioned, expect different. We're going to look at your story, your personal story, and look at through this specific different paradigm of functional medicine, which allows for different lenses, and with this different knowledge, maybe add a different narrative to what your history has been, and hopefully get you in a different direction with different answers. The Living Matrix questionnaire, which I have you complete, actually is going to quantify and give us a score for these particular concepts and these particular factors of health. It's going to give us a score of your inflammation, your gut and barrier health, your liver detoxification. It's going to score your mitochondrial energy health, as well as cellular communication scores. In addition, I'm going to dig through your history and try and figure out what the heck happened to your barriers. What were the triggers? Why is it that you have seasonal allergies? Why is it you have all these frequent urinary tract infections? Why is it that you have had problems with asthma? Why do you have skin issues? All of these are barrier issues that are contributing to inflammation, and that inflammation that then contributes to the immune issues. And so we'll try and reverse engineer this whole process and rewind, starting off by recharging your battery, repairing your barriers in your microbiome, trying to recuperate that liver detoxification, restore some balance overall, restore your energy potential, and hopefully restore hope with a different health story and a new health journey. So again, welcome to Root Cause Medicine, where we do different. The first step towards getting somewhere is to decide that you are not going to stay where you are today, which is just stuck. So hopefully doing different will get us unstuck. Excited to meet you. Let me know if you have any questions. And if you're just listening to this for an educational purposes and really interested in this approach and interested in talking to us, you can set up a discovery call with me, and we can talk about how this can apply to your health issues. We'll talk soon. Take care.